Hello and welcome to the second lecture on digestive diseases, viruses and parasites. Today in Proverbs chapter 30 verse 5, every word of God proves true. He is a shield to those who take refuge in him. So think about this. Remember that what God says is true and take refuge in his truth. Today we're going to look at viruses and parasites in the digestive system. If you ever have an opportunity to take parasitology, I encourage you to do so. It's fascinating and disgusting at the same time. So the first thing we're going to look at is oral herpes, cold sores. These can be inside the mouth, and we call them canker sores, but you can have them on the gums, on the tongue. So those are canker sores. It can cause pharyngitis and it can cause esophagitis. But most cases are caused by human herpes 1, what used to be called herpes simplex virus 1. The virions will form a syncytia. That's what a cold sore is. And that just kind of keeps the immune system away. But the latency is established in the trigeminal nerve of the ganglia. So usually you get infected on the lips, okay, and it travels to the trigeminal nerve where it will lie dormant until usually you get stressed out and this will open back up again. So here is a picture of a poor person with some pretty nasty herpes cold sore lesions. And you can see what we normally call the cold sore is really a syncytia, okay, a bunch of cells that have fused together. And that is very painful. Here's a picture showing that there are 3 branches of the trigeminal nerve, the ophthalmic branch, the maxillary branch, and the mandibular branch. And most of the time, infection is going to occur or take place on the lips, and it'll travel up the mandibular branch and then find a home in the trigeminal nerve. Rarely we do see the syncytia in the ophthalmic branch, and it can cause blindness if it gets into the eye itself. Don't often see it maxillary. So this infection is usually given to us when we are babies, and great Aunt Edna or great Uncle George or whatever has a cold sore. They come and they give us kisses, and oh great, now you infected the baby with herpes. How do you diagnose it? If you've seen one cold sore, you've seen them all. Usually you can buy over-the-counter penciclovir, acyclovir, and valacyclovir. How do you not get this? Okay, if you have cold sore, an active cold sore, don't go kissing on anybody. Don't kiss anyone who has funky looking lips. Actually, the mumps is a disease of the digestive system. It was once very common, but now we have wonderful vaccine that keeps us safe from the mumps. Children did die from the mumps. There's really no treatment. If you do get infected with the mumps, you have a lifelong immunity. Okay, viral gastroenteritis. So we spent a whole lecture talking about bacterial gastroenteritis. So let's look at viral gastroenteritis. Signs and symptoms, Nausea, vomiting, abdominal pain, cramps, diarrhea. Yeah, pretty much the same. But dehydration is a more common complication with viral gastroenteritis. It's caused by 3 different viruses, and the most common here in the United States is rotavirus, which you may have also heard called rotavirus. It's just that Texans can't pronounce their A's. And basically the viruses infect the cells in the epithelial tissue in the intestinal tract, and we know what happens. These are lytic, and so they destroy the cells. In developing countries, the #1 killer of young children is diarrhea, and this is caused by rotaviruses. And you look here, where are the most common deaths? Okay, and we see it mainly in countries that do not have good sewage treatment nor clean water. So you diagnose it basically by saying, I don't find any bacteria like Shigella or Salmonella or E. coli. You have to just treat the symptoms, okay, fluid and electrolyte replacement. And basically to prevent this, clean water, sewage treatment, good hygiene. Where are we seeing this over and over and over? Is that you got to have clean water. Sewage can't be dumped into the water source. Okay, you need sewage treatment plants. And then wash your hands. Can't say that enough. Wash your hands. Phew. And get one of those personal straws if you're going to be traveling out in the jungles or something. The next big viral disease of the digestive system attacks the liver. And remember, the liver is an accessory organ to the digestive system. The big sign is jaundice. And people turn the color of a yellow highlighter. And you'll see it first in the whites of their eyes. And it's a little spooky because you're going, this person has yellow eyes. This is not good. They'll have abdominal pain, fatigue, vomiting, and weight loss. You can get infected and then it won't pop up until many years later. It depends on which virus you get. Usually the liver damage is due to our immune response overreacting. And there are 5 viruses, A, B, C, D, and E. I'm so glad they named them that. So when we look here at these viruses, notice that hepatitis A is considered infectious hepatitis. B is called serum. C is called chronic, non-A, non-B, because that was its old name, chronic hepatitis. D usually cannot cause infection unless it's with B, and then they can cause nasty infections, and it can also cause cirrhosis. All of these can really cause cirrhosis. And then we have enteric hepatitis. One thing I want you to know about the genome, notice that you have positive sense single-stranded DNA in A. In B, it's partially single-stranded DNA and partly double-stranded DNA. Weird. But it's DNA, and if you look down at the bottom, we can see it can cause hepatic cancer. So it can cause cancer in the liver. Hepatitis C is a positive sense RNA. D is a negative sense RNA. And E is a positive sense RNA. So things to think about. How are these transmitted. Notice that A is fecal oral. E is fecal oral. The others are needles, sex. And so we're talking about an exchange of body fluids. So it can be pretty nasty. Can be pretty nasty. Notice that B and C, you can have a chronic carrier. A chronic carrier. Also notice that in A and E do not have envelopes, but B, C, and D do have envelopes. So envelopes are going to make it a little bit more difficult for the immune system to kill. So when we look at this, it's interesting. Fecal oral or exchange of body fluids. Needles, sex, blood and fluids. So when we look at this, first thing you're going to notice is that the whites of their eyes are yellow. This is not good. The liver will be enlarged, or they could have a lot of fluid called ascites in the abdomen. You can use serological testing, do a blood test to decide which virus it is. Basically, all we can do is give supportive care. There are some antiviral drugs that work, but they're kind of hit and miss. We know that interferon and nucleotide analogs can reduce the level of the virus. How do we prevent it? Seriously? Good hygiene. Don't poop in your drinking water. Wash your hands. And don't just run around having sex with everybody. Use protection or be abstinent. Vaccines are available against A and B. And if you've ever worked in the healthcare system, you have been vaccinated because they won't let you near patients unless you've been vaccinated. This is just showing you the 3 types of viral protein particles in hepatitis B, and this is what makes it difficult for the immune system from time to time. Notice this is called a Dane particle, and it is infectious. Okay, and it has a partly single-stranded DNA, and then you have a lipid bilayer, hepatitis B surface antigens, hepatitis B core antigen. If it's round, they call it a Dane particle, and this is the infectious. If it's filamentous, then it's not considered to be in an infectious state. So, yeah, that's weird, isn't it? That's just weird. But it's the Dane particle that is infectious. It's absolutely infectious. So in areas of poor sanitation, which form of hepatitis would you expect to be the most common? All right, what are we thinking about here with poor sanitation? People poop in your drinking water, all right? No sewage treatment, bad water, no clean water. So infectious hepatitis, serum hepatitis, or chronic hepatitis. And you're right, infectious hepatitis because it is fecal oral. Serum and chronic hepatitis are spread by needles, sex, exchange of body fluids. All right, take a break here, pause, stretch, and then we'll go on to protozoan diseases of the intestinal tract. And I'm going to look at a few that you will see here in the United States. Hello, hello. Giardia, okay, intestinalis causes giardiasis. And Most of the time, this is asymptomatic. People don't know they have it, but there is diarrhea and muscle cramping. It can be gassy. It can last up to 4 weeks because remember, protozoans and worms are eukaryotic, and so we have to be careful about how we treat those so we don't kill our patients. Okay? So basically, what we see is that Giardia will form cysts, and this will protect the little protozoan from being killed by chlorine, heat, drying, and stomach acid. And then once they get through the stomach, they open up from their little cyst and then just start to swim around and have such a good time. Yay! They look really freaky. They look like they have 2 little eyes that watch you. And basically what happens is that people drink contaminated water. Usually these are hikers. You know, you're out in the mountains and you're hiking and you see this beautiful little creek and the water's so clear and clean. And yeah, no, there's Giardia. So this is why you should always filter your water, okay? But they swim around in your intestine and they have a really good time, and then you poop them out. Poop out their little cysts. This is not good. Are you getting the idea that maybe you need to be careful about what you drink? If you get contaminated food, then it's probably because you washed it in contaminated water. And of course you wash your hands and yeah, they get stuck on you. So be careful. Just use your common sense. All right. You diagnose this by finding the little Giardia in the stool. Yeah, that's no fun. I've done that many a times. Looked at other people's stool. No fun. We treat mainly with tinidazole or metronidazole, and depending on how bad the diarrhea is, you got to do replacement therapy. But quite bluntly, if you know where you're going is endemic, then use good hygiene and filter your water. Take a straw, water straw. Cryptosporidiosis. Cryptosporidium parvum. This can cause major problems. Okay? Severe watery diarrhea with potential serious complications. The infection comes from drinking contaminated water. Wow. Oral fecal route. Presence of oocytes in the feces lets you know that you're dealing with cryptosporidium. You treat with fluid and electrolyte replacement, and you prevent with don't drink poopy water. This is showing the oocytes in the feces. Poopy water. Okay, next little protozoan is Entamoeba histolytica. Yeah, amoebas. Amoebas can cause severe dysentery, colitis, appendicitis, and they can travel to your brain and cause amoebic encephalopathy and kill you. Usually that doesn't happen, but it can happen. The virulent strains produce toxins, and they have a stage called a trophozoite, okay, that can burrow into the peritoneal cavity or into the blood circulatory system, causing problems. So it's transmitted by consumption of contaminated food or water from contaminated hands or by oral anal intercourse. Okay? Yeah, just don't. Oral anal intercourse, just don't. That's not what those orify are for. So, some people can be carriers. Yeah. And if they poop in the water or they don't wash their hands and then they work on your food, not good. How do we diagnose it? We see the little entomevia in the stool. Eesh. It's weird watching something with the amoeboid movement working through their little stool sample on a slide. Okay, we're going to prevent this by A, not drinking poopy water, B, not eating food that someone else is handling with poopy hands, C, wash your hands. Make sure everybody who works for you washes your hands. Okay? And do not have oral anal sex. That's just wrong because those orify are not for that purpose. Okay, so there are anti-amoebic drugs and they're pretty tough, pretty tough. So individuals in endemic areas, make sure that you drink bottled water and avoid uncooked vegetables or unpeeled fruits. Dr. Wazinski and I went to Ecuador one year together, and she just was always harping on, always peel your vegetables and peel your fruits. If you can't peel it, don't eat it. And this is why. I think that's very good advice. If you can't peel it, don't eat it. If it ain't cooked, don't eat it. Hey, we're going to leave our happy little protozoans and go to worms. Worms. So these are big and they're multicellular and you can see them and they crawl out your butt and it's nasty. Okay? So tapeworm infections. And actually they call them infestations. Ugh, causes disease. So this is a segmented worm. And basically intestinal parasites don't have their own digestion. They absorb nutrients from our digestive tract. Some people will have nausea, abdominal pain, weight loss, and diarrhea. The two big ones in the United States are Taenia sigonata, beef tapeworm, and Taenia solium, pork tapeworm. And so guys, when you go back and you read Leviticus about all the rules, and God says, don't eat pork, don't eat pigs. This is why. This is why the beef tapeworm mainly stays in the gut. And so you don't eat guts. In the pork tapeworm, it will insist in the muscle. And what do we eat? We eat muscle. So, yeah. So this is a typical tapeworm. The head, where the hook and the sucker are located, is called a scolex. And those hooks will bury into the wall of the intestine and stay there. And the suckers help things stay put. And then each little proglottid. So proglottid is this little segment. Let's see if I can do this. Here is a mature proglottid. Each proglottid has male and female sex organs and fertilizes itself to make many eggs. Many eggs. And so what we see here, you have see a mature one, and then this is a gravid. Okay, you can't see the individual eggs, but it is full of eggs. And when it gets full and mature enough, it breaks off the end of the worm and it floats out in your poop. And if you poop in someone's drinking water, then you're going to contaminate them. Okay, so when we look at piggy tapeworm, all right, it starts here. Eggs and egg-filled proglottis are passed into the environment via the feces. Poopy water. Intermediate host ingest eggs on contaminated food. The eggs hatch into larvae and penetrate the intestinal wall and migrate to other tissues. And in the piggy, it goes to the muscle that we like to eat. Human ingest the little cyst in raw or undercooked contaminated meat. The cyst excists and attaches to the mucosa of the small intestine, and then it matures, and the adult worm forms new proglottids, and you poop out more proglottids. That's just disgusting. Cook your meat. So, these things are found everywhere, but mainly we see them in regions where there's not proper sewage treatment. So maybe sewage is put out on the land to help fertilize it, not good, or where humans live in close contact with livestock, and by that I mean their animals, their pigs and cows live in the house with them. Okay? That's how close we're talking about. Basically, you find proglottids in a fecal sample. It can be treated with niclosamide or praziquantel. Yeah, we got drugs. What's prevention? What have I told you? Cook your meat. Cook your meat. Okay? Okay. All right. Pinworms. Pinworms are caused by Enterobius, that's very hard to say, Enterobius vermicularis. And mainly we find these in toddlers in the United States. Signs and symptoms, little person will scratch their butt. I mean really dig into the anus. They're irritable, they lose their appetite, and they're not happy little people. Basically what happens is that the female worm, this has male and female worms, these nematodes, the female worm will move to the perianal region at night, crawls up or down, and lays its eggs. And then little bitty scratches its butt down deep and gets the eggs on their fingers, and then what do they do with their fingers? They stick them in their mouth, or they play with the toy or whatever and stick the toy in their mouth. So in A, you see a female worm on an anus. Yeah, not good. And then in B, these are the eggs. And usually we see the eggs. A lot of times when a toddler it has an itchy butt, what the doctor will do is tell the mother that next time you change a poopy diaper, take a piece of tape, like Scotch tape, and put it on the anus, and then take it off, and they can look at that and see if they can find the eggs. Or you just take the poopy diaper to the lab tech. Yuck. Okay. Like I said, it's the most common parasitic worm in the United States. Most time we're going to identify the eggs. It can be treated with some really good drugs, pyrantel, pamoate, or mebendazole. How do you prevent this? Well, you try to teach your little bitty not to put everything in their mouth. That's the big thing. Wash those hands. Clean that butt. Don't stick anything in your